Good afternoon, everyone. It is 1 o'clock on the hour, and we want to go ahead and make good use of the time. I first want to welcome everyone to the His Health webinar training series. Thank you so much for joining us. My name is Amora Amoyge. I'm an Associate Director working in Healthcare Access and Health Equity at NASDAQ, and I'm helming the His Health project. Today's webinar is a really exciting topic that I think a lot of folks are interested in learning more about, and we'll be talking about utilizing motivational interviewing to engage or re-engage clients into HIV medical care. I'm so very pleased to be joined with our great partners out in Indiana, Tyrell Parker and Abby Shapiro. Tyrell has worked in HIV for the past 3 years at Brothers United, hey Tyrell, at a community-based aid service organization called Brothers United that serves Central Indiana's Black LGBT community. Tyrell has worked there to help to successfully implement the pilot citywide Linkage to Care program that has been helmed and culminated by the Damien Center with Abby Shapiro at the helm there. Abby Shapiro is a routine HIV screening coordinator at Eskenazi Health. Abby has also worked a great number of years in HIV, developing national HIV prevention strategies for youth in Nambia, as well as HIV-specific educational materials for dental students at Indiana University, and most recently concluded a 3-year pilot Linkage to Care program in Indianapolis, focusing on the development of best practices for ensuring that all people living with HIV enter or re-enter and maintain an HIV medical care successfully through the provision of wraparound services and collaborative community care. We want to welcome Abby and Tyrell to the training series. Hey, y'all.
Hey.
How's it going?
Good.
Great.
Awesome. So before we get started, I'll give you just a little bit of an overview of what we'll discuss today. We always like to kick off our webinars with a background on the His Health Project, how we started, what was the impetus, and what are our key products that we'll be delivering when we launch this summer. And then I will pass the baton over to Abby and Tyrell, who will dive into all of the information and knowledge they have to share around how to successfully leverage motivational interviewing as a tool for re-engagement. And then we'll also discuss, we'll have a little bit of time for a Q&A at the end. A little bit of housekeeping, everyone is on mute. We'll be collecting questions at the end. There is a Q&A chat box up top, a chat box or a Q&A box. You can click on either one to put your questions in. Feel free to enter questions as you go as well. I'll be checking that frequently. And any technical issues that you're having, you can also put your questions in there, and I'll be sure to help you out. So what is His Health? A little bit of background on the project. His Health is a collaboration with the Health Resources Services HIV Health Resources Services Administration's HIV/AIDS Bureau, or HRSA-HAB, lots of alphabet soup there. Really, this resource is being developed as an online platform and tool to help providers to access trainings, CMEs, CNUs, and models of care that have proven efficacious and successful in engaging Black gay men, not just into HIV care or preventative services, but also sexual health services in a way that is patient-centered and sex-positive as well. In terms of how we identify, His Health identifies as a united community of healthcare practitioners as well as public health advocates who are passionately committed to uplifting the standard of care for Black gay men. In terms of our ethos, we believe that shifting the HIV epidemic must be a shared responsibility. So certainly Black MSM patient communities have a responsibility to bear, but so do providers, and so do government officials and health department staff members and administrators who are operating at every level of our U.S. healthcare system. We all have a part to play in turning the tide in this epidemic. And with regard to our vision, we are really looking at a world where HIV-related, race-related health disparities among Black gay men are addressed vigorously and to no end. So again, we'll launch this summer, and the two key products that we'll be sharing again will be creating a resource or inventory of promising strategies for programs nationally that are doing really great work with engaging Black gay men into HIV care, preventative services, as well as sexual health services. And we're also excited to debut a cohort of original continuing medical education and continuing nursing education units that are designed to accelerate care for Black gay men in a way that is culturally responsive and competent and humble. And then thirdly, the hishealth.org resource will be used to disseminate those materials far and wide. I talked a little bit about our mission, but our ethos is to grow strong together. We are looking to do this in partnership with providers and patients and all stakeholders who are interested in fighting the fight. And with that, I'm going to turn the baton over to Abby and Tyrell, who will jump into our presentation. Abby and Tyrell, take it away.
Fabulous. Thanks. Hi, everybody. All right, next slide.
Sure.
All right, so we're going to start with just an overview of the Linkage to Care program that we developed here in Indianapolis a couple of years ago. And if you've come to some of our webinars prior to this, then you've seen some of these slides already. But we want to make sure that everybody has an overview of the program and how it worked. The focus of Linkage to Care program, or L2C, is to provide individualized long-term one-on-one support for Central Indiana's highest needs clients living with HIV. We did this through a research project that was supported by Johns Hopkins University with funding both on a federal level from AIDS United and locally from the Health Foundation of Indianapolis, Indiana AIDS Fund. It was really unique in that we looked specifically to build partnerships with agencies locally that were focused on serving and addressing the specific health disparities in our community that really do sort of mirror those on a national level. So we partnered, the Damien Center partnered with Brothers United, which is a small AIDS service organization that mainly serves young Black MSM and the transgender community. We also partnered with Women in Motion, that is a really small agency locally that focuses mainly on health education for women of color. And we also partnered with Indiana Latino Institute, and we had linkage specialists placed at each of those locations, and the Damien Center worked with each of those agencies in order to find the right linkage specialist for each of those agencies.
And it's important just to highlight that most of the linkage to care specialists at these various agencies were peer professionals. So when we talk about motivational interviewing, definitely want to highlight and point out that one of its most effective and impactful points was that it was delivered from peer professionals from these various agencies. So just wanted to highlight that.
Yeah, and even to go further into that, we really specifically hired people that looked like the communities that they would be working with and that had experience with those communities and were part of those communities. And that is something that, can't be overstated how important that is. It's not to say that I can't work with someone, a woman of color, but there's something uniquely qualifying Tyrell to work with his own community. And that's something that I think also made motivational interviewing a big piece of, and a helpful piece of really reaching the community that he was serving and is serving now. Throughout the program, we re-engaged 187 people in HIV medical care and supportive services. By and large, the average health status of clients at enrollment was a relatively small CD4 count and a relatively high viral load. Some of the people that we engaged, especially early on in the program, had viral loads in the millions and CD4 counts, around 2 to 10. Within the first 6 months of engagement, sometimes it took longer, but on average, within the first 6 months of engagement in the program, people's CD4 count increased quite a bit, and their viral load got to an undetectable viral load. And then additionally, they were successful in maintaining that throughout 18 months of engagement in this research project. Next slide. And you can see here from the Cascade that we have both the Damien Center Linkage to Care Cascade, kind of mirroring that of the national HIV treatment Cascade. And what you'll see from that is that we really had just an enormous amount of success with this program. And I think we're very, very proud of of the work that we did, we were able to really successfully engage people, and I think because the really intense support that the clients received, they were able to really successfully stay in care and stay on their meds and ultimately attain a suppressed viral load.
And motivational interviewing was crucial to that success in helping clients identify their barriers and their risks so that they can maintain and become virally suppressed, remain retained in care. So that's what we wanted to do, is definitely highlight some of the program successes to show how motivational interviewing is key to that success.
And especially at each of those steps, if you look at the Cascade, you can use motivational interviewing at each of those steps, and you're able to kind of understand what they need at each of those levels. So when they just start entering or re-entering into care, how can you utilize motivational interviewing at that step, and how does that differ from that point to helping them to start on medication and then to stay on medication to the point of attaining viral suppression and being able to stay at that level as well. Next slide. In terms of demographics of the program, you can see from this slide that that about 50% of the people that we were able to re-engage in care were Black, about 60% of them were male, and then from the age demographic, it really was kind of at all different levels between ages 18 to 64. We were able to really successfully reach people at different levels or at different ages, and use different or understand that clients at those different levels need different things. Next slide. By and large, the people that we served were lived at poverty or below, and there's certainly some very unique challenges and barriers that come with living at that level of poverty. Additionally, many of the people that we served had less than a high school diploma or only a high school diploma or GED. We also, Tyrell could also speak to working with people who identified that as one of their goals, that they wanted to attain their GED, and saw that as a,
So we just wanted to kind of highlight this and point this out, because this was part of the information and the data that we collected from the program participants. And it's very important to understand the complete person, the whole person, all the challenges and obstacles that they go through, not necessarily just re-engaging in medical care, but also how does their education play into their motivation and their reasoning for wanting to re-engage in care, to be alive, to be successful. So it's important to track accurate data for clients, because we utilize that as well in getting a full picture and understanding our clients.
And that was definitely something that was really useful for us. Because this was a research project, I think that really helped us to identify what specific metrics did we want to be gathering, but it also, we did a baseline survey with each of the clients, and that helped us to have the clients really speak to what are their unique barriers and needs, and that really, I think, helped to guide practice in terms of what did the linkage specialists want to focus on, because it was really easily identified through these survey tools as well. Next slide. And this is ultimately, these were kind of the I don't know, baselines for things that we sought to work on in the work that we did with the Linkage program. We wanted to really ensure that it was client-centered, strengths-based, and that clients were identifying for themselves what were their barriers to care, and then systematically eliminating those barriers. And that really was the foundational pieces of what Linkage to Care looked like through this program.
Next slide. All right, so now we're going to jump into the heart of motivational interviewing. So Motivational Interviewing 101. Motivational interviewing is a client-centered counseling style for eliciting behavior change. just want to highlight that. It's client-centered, and its main purpose is to get the client to understand the behaviors that they currently have that they are wanting to change. So client-centered and behavior change, I would say from my perspective, Abby, are the two most important things to highlight about motivational interviewing.
Absolutely. I agree. Next slide. All right, so the core elements of motivational interviewing are, again, like Tyrell just said, that it's client-centered. It is, just to define it, it's a semi-directive counseling style used to elicit behavior change, and it helps clients to explore and resolve ambivalence. Because oftentimes the clients that we've served and that we continue to serve kind of identify all of these barriers to care that feel insurmountable. And so really try, and oftentimes they are. Because there's systemic barriers to them being successful in medical care. And especially if you add that someone is Black and that they're gay and all of these things, make it so that it may be impossible without additional support for them to really identify how do they make those steps in order to make it through those barriers and achieve success in medical care.
Right, so a great specific example of ambivalence that I can think of is, let's say, for example, you have a young Black MSM that enters your facility and they want to re-engage in care, but they are not in a comfortable living situation. So they're staying with a partner who may be unaware of their status, and me going to the doctor or going to a medical appointment may cause some frictions or frustration. What do I do with my medication? What do I do with my pills? So that's a great example of ambivalence. On one hand, I understand the need and the importance for getting the medical care, but then on the other hand, I have a very real barrier. So how do we work through that? So making sure that we talk to clients to get them to understand, see that ambivalence, and then start to work through it.
Yeah, exactly. So it's also, motivational interviewing is also motivational-based. It's a method that works on facilitating and engaging the innate motivation within a client. So really understanding that, and if we go back to that example, we can see that this person understands the importance of engaging in HIV medical care. They want to do that, but at the same time, they don't know how. And so understanding that there are, within each person, there are these innate motivations. There's something in there and it may not be that they want to engage in HIV medical care at that time. They may not see that as important. And so really understanding what is it that's going to help them to engage in care. Additionally, looking at client readiness, recognizing and accepting the fact that clients who need to make changes in their lives approach counseling at different levels of readiness and change in order for them to change their behavior. So if you see to the side of this slide are the stages of change. If you are working with someone who is still in pre-contemplation, but yet you want them to be in the action phase, you're going to be unsuccessful. So really understanding that there are these very concrete stages of change that someone has to work through in order for them to be successful. And if we are stepping in and trying to get them at the wrong stage of change, we're going to be unsuccessful and they're going to be unsuccessful. I think the other important piece of that is understanding that people are going to move through the stages of change forward and backwards throughout the course of time that you're going to be working with them. So maybe they are at the maintenance stage. Maybe they've made it all the way through all of these stages of change and made it to the maintenance phase, and they've been really successful in HIV care for maybe even a number of years, and then something's going to change, and they're going to slide back and be back to a point where they're not successful and they're not able to maintain in care, and really working with them and understanding that this is a fluid thing. And so it's asking the right questions to them and helping to understand what has changed, and but we're also understanding that they had success at some point and that they had these motivations to be successful and to maintain and care during that period of time, and helping to understand those things and help them to move through those stages as well to make it back successfully.
I just want to stress the importance of training the staff on understanding the stages of change, because one, it helps to make sure that this actually is client-centered, because a lot of times when we're working with a client, we can become frustrated because the client just isn't moving fast enough.
Yeah.
They're not moving through the stages of change. Or sometimes when a client relapses and may go from maintenance back to pre-contemplation or contemplation, we feel a certain type of way. So it's important to train the staff on understanding that client-centered means that we allow our clients room to go back and forth through the stages of change, and understanding that it's our responsibility to be resilient, and also to help our clients understand that, that this is a natural part of the process.
Yeah, really, the more that we can understand and train our staff to understand that, the better, because, again, like if we're pushing them at the wrong stage, nobody's going to be successful, and it might actually make it harder for them to make it through those stages of change if we're trying too hard at the wrong stage. Next slide.
Cool. Hey, Tyrell, we had a couple participants just ask if you could speak up just a hair.
Okay, will do.
Awesome, thanks.
Okay, so next we're going to talk about a few of the important principles of motivational interviewing. The first one, and it's a simple acronym to remember, RULE. So the first rule is R, resist the writing reflex. And that is very important because, once again, going back to a client-centered approach, a lot of times as providers, we think we know the answers automatically. So we immediately jump to, let me fix your issue, let me solve your problem, but it's not client-centered. And when you have an instance of, let's say, for example, things don't go right for a client, clients will say, well, this was your idea, this was your suggestion, you told me to do this, well, as opposed to, okay, this was something that was self-directed, something that you came up with, might not be working out, but let's stay accountable. So it really does make sure that it's client-centered, and it also holds you accountable to make sure that you listen to your clients. So skipping down to a rule, resisting the writing reflex, make sure that you listen to your clients, that you're not so focused on, let me jump in and fix the problem, but I'm really listening to you. I'm really taking the time to understand what your motivations are, and then beyond that, so I'm resisting the urge to reflex, which makes me further take time to listen to you, which makes time for me to better understand you, which helps me to empower you by helping you to set your own goals.
Absolutely.
Next slide.
All right, so there's some essential skills that are useful in motivational interviewing, and I'll just go over those as asking open-ended questions, providing affirmations, using reflective listening, and periodically providing summary statements. And we're actually going to move into the next slides talking a little bit more specifically about each of those. But what we've found through motivational interviewing is that if you do ask the right question in the right way, you're going to get more substantive answers. And so asking open-ended questions is really important. Also making sure that you're continually supportive of that client, so really reserving judgment from what they tell you as they tell it to you is important, and helping them to understand that they have had successes in the past, that they might not view as successes, and that maybe at first it's hard for you to identify that those are successes as well. So if we look at people who are homeless, for instance, that it's easy to pass judgment on that, but it's also really easy to see that they have amazing resilience and are finding ways to survive in really, really oftentimes bleak circumstances. And so finding ways to really understand what your clients are saying and to support those things that they've done. Reflective listening is something that we're going to go into in more depth in the next slide, but really listening to what someone's saying and then trying to say back to them what you've heard is really important, because oftentimes you're not going to hear exactly what someone's saying, and making sure that so listening to what they're saying and then taking time to repeat that back to them in your own words or using their words and saying, making sure that did I hear you right? This is what I think I heard you say. And then also periodically providing summary statements. So that's kind of very much reflective listening as well, is taking the time to kind of more globally take a look at, okay, this is what I think that I heard you say, and here are some very specific things that I think I've heard. Next slide.
So next we're going to go more in depth on reflective listening. So reflective listening, I cannot say how important it is. And on the last webinar that I did, someone asked the question, can you teach someone how to listen? And they thought the answer was no. My answer was absolutely yes. Listening is a skill and it can be taught. So I just want to stress the importance of listening. So start from the obvious perspective that a client is the author or the expert on their lives. Once again, when we meet someone, we immediately diagnose them, immediately come up with a treatment plan, and we remove the client from the situation. So it's always great to start out from the perspective of, take for example, that client that's homeless. Okay, you have been living in this situation, you have navigated these spaces, you have survived being homeless. Let me sit back, let me listen to you for a while. Because a lot of times we can't relate to some of those experiences that our clients have. So how can I be an expert on what it's like to be homeless if I've never been homeless?
Or even, oftentimes we step in thinking that person is homeless, they must want housing.
Yeah.
And maybe they don't. Maybe that is maybe that is what they want, and maybe they're comfortable in that situation, or maybe they're not ready to make a next step to seeking stable housing. Maybe there's something that is a more pressing need, but it's so easy for us to look at as someone who's homeless and say, oh my God, let's step in and work on a housing application right away. That might not be their number one barrier. That may not be the thing that they've identified. And it really is ultimately, we want to look to them as the experts of their own experience and allow space for them to speak about that.
Absolutely. So to the second bullet point, we can see the blind spots sometimes that our clients cannot see, and that's because we look at it from a higher level. The forest as opposed to being down in the weeds. So a lot of times we may pass judgment on a client because of that. But we're able to see their blind spots, but we don't know their full story. We don't know what caused them to be in that situation, what caused them to have no motivation for re-engaging in care. So sometimes it's taking a step back, assessing it, learning more about all of the competing factors in that client's life before we're so quick to point out that blind spot or point out what the client does not see. And then also, if we want to know these things, clients must tell us. We must create an environment, we must create a climate where we listen, where we pay attention, where we make the clients feel valued, respected, appreciated, listened to. And then if we sit back and really take the time to listen to understand as opposed to listen to respond, then people will start to reveal those intimate personal details about them that reveal their motivation.
Absolutely.
I just wanted to point out, once again, what Abby said, what you think a person means is not always what a person means. So we always want to ask clarifying questions. and restate what they said. Perfect example, and I even use motivational interviewing in my personal life. And I was talking to a friend, we were having a heated discussion about police brutality. And we were having a very heated discussion, and at the end of that discussion, I said, okay, so it sounds like you're saying, and then I repeated it to him, and he said, no, Tyrell, you're not hearing me at all. That's totally not what I'm saying. So just taking time to rephrase and make sure that I actually hear you, it shows that you're listening to me, and beyond just listening, you're trying to actually make sure that we're communicating it on the same page. Next slide.
So in terms of deepening reflections, at the top of the slide is an example of something that someone might say. So I'm not too worried, but it's been over a year since I had a syphilis test. So if you take that statement, you can really use motivational interviewing to get into the weeds about, well, what are they really saying when they say that, and it's a couple of things. So they're not worried, but they brought it up. So are they really worried about it? They brought this up as a topic, and it's been a while, clearly. So we have some facts here, is that they haven't had a test for syphilis in a year or more, and so then you have to get into why did they bring that up, and why are they saying they're not worried, but they're also acknowledging that it's been a while. So there's a couple of different ways that you can kind of get into that. So some of the actual skills of motivational interviewing are paraphrasing, so moving well beyond what a client's words are, and present information in a new light. So taking that quote and trying to rephrase it and say, this is what all right, so it sounds like it's been a while, and that you understand that it's important to get tested annually for syphilis, perhaps. Is that something that you think? And amplifying it would be overstating what a client has said, which often increases the intensity by pressing on the absolute or resistant element. So it sounds like like syphilis is something we should be worried about. Have you heard that syphilis is on the rise in Indianapolis among gay men? Did you know that? A lot of people I know actually have gotten syphilis recently. I wonder if it's time to get tested. So not necessarily it's saying that it's their responsibility or necessity for them, but like factually, this is a big issue in Indianapolis. And so how do we then, by giving that information, we're saying, oh, it's been a while. Okay, you're saying this. I wonder why you're worried about this. Using a double-sided reflection would be kind of looking at both parts of somebody's ambivalence. So they're worried about this, or they're not worried about this, and they know this information that it's important to get tested. And maybe they're having some sort of symptoms. Maybe that's why they brought this up.
And that's important, because what it does is that's very crucial in helping the client or the person you work with to really understand how the two don't go hand in hand. How I'm worried about it, but at the same time, I'm not really worried about it. I have all of this information about it, but why do I not want to get tested?
Exactly.
And notice what Abby did not do. She didn't first jump into it. Oh, you're worried about syphilis. You must be sleeping around. You must be having condomless sex. She didn't do that. What she did was she restated it. She amplified. She got the client to identify both sides of his own ambivalence. So she's moving him in the direction, getting him to see that he needs to get tested for syphilis. We know that he needs to get tested for syphilis, but we're trying to get him himself to identify that he needs to go get tested for syphilis.
Exactly. Yeah, and then we know that by deepening our reflections, if it's an effective measure, we know that we can address the emotions that are either expressed or implied. And I think that that's an important piece of motivational interviewing, is that it's not just what someone's saying, but it's also what they're not saying by what they're saying, if that makes any sense.
So body language, body cues. One thing that's like very important to me is what I always talk about mental health with most of the people that I work with for the first time. And on our intake form, it asks if you're interested in seeking mental health services. And I always can tell when someone, that ambivalence is, they laugh. When I say, are you interested in mental health services? And they kind of chuckle like, no, well, why would you ask that? And then, you know, like, that's very telling, because why do you laugh and chuckle when we talk about mental health? And you did not laugh or chuckle at anything else. I asked you if you were homeless. I asked you very personal, intimate details. But when I asked you something very specific, for me, that was a non-verbal/verbal cue that there's a little bit more there. So we start to press and look, ask those deeper questions. Sometimes it's just something as simple as that.
Exactly. Next slide. And I think we've said this, you know, a number of times, that it cannot be overstated how important it is to ask the right question at the right time in the right way. And that is really at the base, or at the forefront of motivational interviewing. And I think it really speaks to why our Linkage to Care program has been so successful, is because we utilize motivational interviewing in all of our interactions with our clients, and it kind of goes back to the stages of change. That slide where we talked about, you know, is that if you're not asking the right question at the right time, you're not going to get the right answer. You're not going to, you know, if someone is in contemplation and you're asking questions about action,
Mm-hmm.
It's not going to work. And so really making sure that you're hearing what people are saying and that you're listening in the right way, then you're going to get more meaningful answers and more meaningful action.
Next slide. So back to open-ended questions. Short reply information, gathering questions, these are necessary during client contacts. I can tell you there's a huge difference between you ask a simple question like, did you drink alcohol this week? Well, yes. That may or may not be a problem. You know, if you drank one alcoholic beverage, may not be a problem. If you drank every single day this week, multiple times this week, then that may be an issue. But how I ask the question will determine the response that I get. And it's very important also, because I've highlighted this and pointed it out in the previous webinar, but trauma-informed care means you don't want to overburden your clients with questions also. So that's why it's important to ask those right open-ended questions to elicit the right response, because clients get tired of being asked 1,000,001 questions. So limit your questions to the right questions, make them open-ended, and get the true responses that you need. So a better question would be, how often and how much did you drink? So that's a better question, because it gives us a better gauge and a better understanding. But then an even deeper question, okay, when you decide to drink, tell me about those circumstances. Because if I'm your provider or your Linkage to Care specialist, yeah, I want to know that you drink, because that's important, because that will determine, that may determine how your HIV regimen goes. But what's most important is the why, and we want to understand why, but it's also important to highlight we don't just ask why. Why are you drinking? Because that won't get the right response. So we need to be more specific. When you decide to drink, when you decide to skip your medication, when you decide not to go to that appointment, tell me about the circumstance.
And I think that that's really important in harm reduction strategies, is asking a question like that is, when you decide to drink, tell me about the circumstances. So if we're seeking to, if we know that, that our client does a lot more risky behaviors when they go to a sex party if they take, you know, specific drugs during that time. Then when you've gotten that information from them, that's when you're able to start helping them to make changes from a harm reduction strategy. I mean, it's not reasonable to say, all right, so you have to stop going to sex parties. But it may be reasonable to say, all right, so we know that in these situations, these are the choices that you tend to make, and you don't always feel comfortable with those choices, that you're having many more sex partners in those situations. So is it reasonable to decrease the number of sex partners by not taking that drug at that time? So you know that you make better choices when you do these things. So how do we get to that next step? And I think that that's an important piece of really asking those more meaty questions, because you're going to get more meaty answers. Next slide. So in terms of key questions, there comes a point when the focus will shift from building motivation to asking for a commitment to change. And so that's something that's really important, is asking those questions at the right time. So what are the next steps? And this is really important, is that as a provider, that we aren't identifying those next steps for them or getting those, making sure, or forcing them to make those changes, because it's not going to be successful. And so really helping them or creating space to ask the right questions. What are the next steps? So what do you think that you'll do now? Or how will you proceed? Or, or here something more specific is, how do you plan on, or what do you plan on doing to prepare for our next meeting? So making sure that we're not suggesting those things, but creating space and asking the right questions in order for them to identify what do they want to do next.
Exactly. When you talk about re-engaging someone in care, it could be a simple 3 steps of, okay, in order for you to get on so we've identified your motivation as you want to get reconnected to a medical provider. Well, what are the issues that are preventing you from, what are the next steps that we need to take in order to get you to a medical provider? Well, first step, you realize that you don't have insurance. Okay, well, what do we need to do to get you insurance? Well, it may be the client may identify 3 basic steps. Okay, I need to get an ID, I need to get a birth certificate, and I need to schedule an appointment with my case manager so that we can get the ball rolling. Sometimes motivational interviewing is that specific, and you have to get back down into the weeds, because once again, when we're thinking about trauma-informed care, we're thinking about a lot of our clients are people who, I said it before, are broken, beaten, walk into our offices and our spaces with very limited hope. So a lot of times, saying I want to become virally suppressed is too far ahead. So sometimes it's all about drilling it down, making it simple, next steps that are attainable.
But even when we look at, at those specific steps, okay, so they want to get a birth certificate so that they can get an ID, so that they can get insurance, then how are you going to get your birth certificate? What steps, specific steps, need to be taken? And if that means like, oh, I know that it's in a storage unit in another state, is that reasonable? Is that something that's attainable, or is it not? Okay. Or they could order a new birth certificate, right? Do they have the $25 to do that or not? And how are they going to get that money? Is that something that as a provider you're going to need to get a voucher in order for them to be able to pay for that? And so really making sure that those specific goals are attainable, and providing the support in order for them to do that. So even if we're specifically saying, all right, you're leaving here with these goals in mind, that these things have to be attained, then really looking at, are they actually attainable or not, is important. Next slide. In terms of affirmations and summaries, your role is to instill hope and the belief that a client can indeed change. I think that is so important, is that sometimes, in the end, our clients are the experts of their experience, and but they also may oftentimes come to us really beaten down, and there is in the beginning, you may have to be the one that's doing the hoping for them. That being said, you can't always be doing it for them, or you're not going to be successful and they're not going to be successful. So there has to be some sort of middle ground. But I think especially in the people that we served through the Linkage program, it felt like in the beginning, oftentimes, it really was it was the Linkage specialist that had to be doing that hard work in the beginning for them. And being willing to hope for them and help them to know that this is attainable, and that maybe we're not going to get to viral suppression tomorrow, because we're not. But so being realistic is really important, but also being able to help people to believe that these are attainable goals, and that we just have to create the right steps and provide the right support to get there.
And one thing also is to go along with the affirmations, you have to celebrate the small successes.
Yes.
And then you have to remember to be mindful to check in with your client, even if it's 30 days out. Okay, we may not be at the ultimate goal, but within 30 days, we've accomplished getting your ID. We've accomplished getting your birth certificate. We've accomplished connecting you to a care coordinator. We have your first medical appointment on the books. So those are small victories and small successes that instill that hope and help keep a client going and help keep them motivated along, because it's a long journey. It's not always a 30, 60, 90 perfect cookie cutter road.
Absolutely. Yeah, I think that's really important to celebrate those little successes, because our clients oftentimes have been out of care literally for years, and felt like there were for them there were compounding barriers to getting back into care, and so the fact that they were able to attain their birth certificate is a big deal, because for them, they didn't have an ID for years because they couldn't get a birth certificate to get their ID, to get their insurance, and so these are all building blocks, and they are big deals for our clients if you help them to see them as big deals, and as they move forward, they grab on to help them to understand that that these are a big deal, and that this is a small step to a much larger goal. In doing so, you need to be genuine. If you're not going to be genuine, they're not going to feel it, and they're not going to be engaged in care. And again, using affirmations, that's important. How you ask the questions are going to elicit different responses, and we've been through that, and summarizing what you hear. So, and I think that this is really important, assisting clients to organize their experiences and goals, and really making sure that, so they've identified maybe these large goals and these small goals, and okay, so what do we need to do specifically to attain these goals, and the things that, and really acknowledging the successes that they've had as they step through those goals and attain those goals.
And very specifically for us, we had a goal-setting document that we use with the bulk of our clients at a minimum or at the most to help them identify their 3 goals that they hope to work on, whether it was a 30-day, 60-day, 90-day. And it works both ways. It helps us accountable to make sure we're getting the right information, and it allows us to check in with the client and once again to be able to say, hey, where are we at on accomplishing your goals that you set for yourself, which is very powerful.
And stepping back and having it documented, I think was really useful, because you were able to go back then and look at that and say, okay, you said that you wanted to do this thing, but this is where you're at, and maybe especially if they get, sort of off course, and really trying to bring them back to say, all right, so what steps are you taking, or maybe those aren't realistic unrealistic goals anymore. What are realistic goals, and how do we attain those now? Next slide.
Okay. So recognizing and reinforcing change talk represents statement about change. Client statements that indicate they have the desire or ability to change, linked to a specific behavior, typically phrased in present tense. So client talking about behavior. So there are very specific cues and very specific things that you can listen for to identify where a client is at in the stage of change. So these are great examples of things to kind of look for. So there's the desire to change. I wish things were different is a great example. The ability to change. So the difference between desire and ability, wanting to change versus actually being able to, actually being in a physical space, an emotional space, a wellness space, and being able to change. Well, I did stay sober, clean and sober for a year. Understanding the reasons for change statements. So I guess I wouldn't have to think about it if I used a condom versus the need to change, understanding that you actually need to change for some reason or another. I can't go on with these behaviors I've been doing. So change talk is very, very important because once again, if we are trying to move a client through the stages of change to increase their motivation, we have to be able to listen and we have to be able to recognize where they are.
And those cues, yeah, those cues are really important.
Next slide. So lastly, before we open it up for questions, we're going to talk about Daniel, who is a combination of two clients that we worked with here in our Linkage to Care program. And we're going to talk about his story and then apply specific examples of how we have used motivational interviewing to move him through the stages of change. Next slide. So just really quickly, who is Daniel? He's 26, a black gay male. He was referred to the Linkage to Care program through a local infectious disease provider. He had a CD4 of 10 and he was hospitalized for pneumonia, came through the emergency room, and that was how he was referred to Linkage. A little bit of his backstory. He experienced homelessness as a teen. He was rejected and isolated from his family, kicked out on the streets, forced to do some commercial sex work, spent some time in prison, was incarcerated, which is where he contracted HIV. His story is a little unique because he purposely contracted HIV because of some depression and wanting to feel like he wanted to die, and he thought HIV was the way out for him. He is currently, well, at the time of intake at Linkage to Care, he was homeless and a substance user after being recently released from prison. And to add extra insult to injury, he had just lost his mother probably about 2 months before I met him, and he saw absolutely no reason to live. Next slide. The reason why I chose Daniel is because Abby, who is my supervisor, was my supervisor, knew that he was probably the most difficult client or the most hard to reach person that I had ever worked with, because one of his major challenges and ambivalence is how do you motivate someone who seems to have no motivation? He had no reason to live. He did not want to go to the doctor, did not want to get on medication, did not want to talk about his mental health, just was completely checked out of life at that point. Next slide. So, how do you motivate Daniel? So one thing that Daniel said that was really important, Abby had to help me out with this, is he did not feel as though he had a reason to live. So for us, we had to start there, and we had to help him understand and identify what were his reasons for living. So we asked those questions, we paraphrased, we rephrased, we asked those probing questions. So when he said, I feel as though I have no reason to live, so it sounds to me like you're having a difficult time right now, and you're not sure how to move forward. Is that correct? So we're saying it in a different way. What is usually going through your mind when you start to feel this way? You know, because I met Daniel over a few times, and sometimes his personality was bubbly, and he had a great personality, and people loved to be around him. So I'm like, okay, Daniel, you're not sad all the time. So when you do feel sad, what causes your sadness? What are your triggers? So then he started to reveal and let his wall down. He started to say that he felt the most sad when he thought about his mother. So this is where, to kind of combine the webinar we did last week, where we talked about don't be afraid to use yourself as an example. I've lost my mother before. So that was where I got personal with Daniel, and I shared that personal story. And I said, you know what, I get sad when I miss my mother too. What do you miss about your mother? So then, from there, he started to reveal even more details. She was the only person I ever told about my HIV is what he told us. I could talk to her about anything. She would make sure that I always took my medication. So then, once again, going back to the reflective listening, going back to the motivational interviewing. So your mother provided you with some emotional support, which is important. Okay, so acknowledging that he misses his mother, but he's also missing that emotional support. So who else in your life can provide you with that emotional support that you need, that was important when you were engaged in medical care, when you were taking your medication regularly? Next slide. So then from there, Daniel started to reveal more. So he started to reveal that he did have people in his life outside of his mother, his cousin, his neighbor, his sisters, and his nieces. So Daniel, how do you think those people would feel if you went away? You know, so getting him to see that there are other people that care about his life beyond just his mother, because I realize that that is something that motivates him, is having that support. It seems like your mother was crucial in you taking your medications because she saw how important it was. What would your mother think of you being off your medication now? She would be sad, she would be mad, she would be disappointed. She would probably slap me upside the head. So then going even further, you know, so I know for me, I've lost my mother. It's important for me to make my mother proud. You know, how important is it for you to make your mother proud? And then from there, he was able to see for the first time that my mother would not be happy with me knowing that I'm not in care, knowing that I'm not taking my medication. So guess what? For the first time, we've just revealed something that will motivate Daniel to get back in medical care. We actually revealed two things. We revealed that he has family members in his life that he cared about, and we also revealed that it was important for him to make his mother proud. Next slide. And I said I chose Daniel because he was a difficult story. So even then, the work further continues. So he started to attend his medical appointments, but like a lot of clients, he wasn't consistent. He went to his first medical appointment, got labs drawn, but did not return to his appointment to get medication. So then he came into my office a few weeks later, and he was violently ill. He was vomiting. He came in like literally with a plastic bag wrapped around his neck, where he was just vomiting into the plastic bag. Sorry to be too gruesome, but it's reality. It's what really happened. So then he started saying things like, I don't want to experience this pain. I wanted to die, but HIV is a slow death. I've experienced this pain before. I don't want to experience it again. So listening, understanding, that's another motivation. Okay, so Daniel, you feel this way. Do you have to feel this way? What are some ways that we can work together to make it sure that you never feel this horrible again? And for him, that was another motivation. We were able to use that motivation to say, okay, Daniel, well, what are some steps that we can take to make sure that you don't feel sick? Well, I can start my medication. Okay, well, what do you need to do to start your medication? Well, I missed my appointment 3 weeks ago. I need to go back to that appointment. Okay, what do you need to do to go to that appointment? I need to schedule it. Who do you need to call to schedule it? I need to call the Damien Center. When do you want to call? Let's call now. So we drill down and we get that specific. But once again, want to highlight that it's never me saying, Daniel, you know you're sick because you're not going to the doctor. notes, me asking those questions, getting him to see his motivation, getting him to move through the stages of change. Next slide. So his story continues. We work with Daniel to get him back in medical care, to get him adherent. So we're just really working to make sure that he stays engaged in care through motivational interviewing. And we're also starting to use motivational interviewing to address some of the other factors that are going on in his life, such as mental health, substance use. Since then, he is stably housed, does go to medical appointments regularly, but it's still a struggle. It's still a challenge to get him to be adherent and to get him to be virally suppressed.
And it's just so important to have those, you know, because the more that Tyrell learned about Daniel as they built that relationship, then he was able to kind of go back and say, you know, let's look at, okay, well, these are some things that you've told me in the past, and remembering those things to really guide moving forward, and helping him through, okay, so there was a period of success. And during that period of success, here are some things that I saw, and being able to really build that rapport and use those tools over the course of time to kind of help build that story and help guide Daniel to move forward and build on successes that have worked in the past. And I think it's just I don't know, a good story of, you know, of working through those challenges but being realistic that it's not going to be, you know, in the very beginning, Tyrell had, you know, pie in the sky goals of being successful 100% of the time, and then, you know, and then Daniel will come into his life and all of those stories, and it's not going to be successful right away, and it's not going to be successful 100% of the time, but you're going to keep working with your clients to build on those small successes and reach attainable goals. And as you build, you know, as you attain small goals, you're more successful and more able to attain those larger goals. So, all right, I think that's it. If we can open it up for questions now.
Awesome. Great presentation, you all. Getting really good feedback from folks. This is super helpful. I really love hearing sort of tips that occur and are generated on the ground as you are going and working as experienced linkage to care specialists. Feel free to enter in any questions that you may have through the chat box or the Q&A, or you can send them by email to hishealth.org, and I'll start with one that I have received from one participant. They sort of referenced how all of the tips that you are giving point to the fact that linkage and engagement into care is, you know, not a straight path. It can be really circuitous. You're going back and forth, and to your point, it's patient-centered. A participant wants to know in what ways do you communicate with your funders, government officials, whoever you report to for continued financial support, that linkage and re-engagement is not always linear, and is not always going to kind of happen in that 30 to 45 days sort of time frame, et cetera.
Well, that's a really good question.
Good question. I think a lot of people are paying attention, so go ahead.
I think one of the things that was really useful for us is that for the research piece of our program, it was 18 months of engagement, and that actually gives you a really good amount of time, a good chunk of time to be able to kind of move through those successes and challenges and the going back and forth and that sort of thing. And ultimately, we had more successes than we did failures. And even if we did, you know, move back a couple of steps, is that ultimately we were able to show over the course of time that ultimately our clients were successful, even if they did have, you know, ebbs and flows, which certainly there were. and being realistic about that with the funders, I think, is also important.
And then also, one thing to highlight, when Abby came on board and designed the Linkage to Care program, one thing she always told me was it was difficult for her designing the program because there were no proven models for success that really show what a solid Linkage to Care program looks like. So now the benefit of this research project is you have those models of success, and you have a great program model, but it's built on an 18-month program. You know, so this is a great model, and this is evidence that we can take to funders and say, this is a model that works, but it's not that tight 30, 60, 90, those strict, rigid deadlines that are often placed on us.
It's not going to be successful in 30 days. There's just no way. And I mean, it depends on what your goals are. And so if the funder wants you to be able to show, you know, whatever viral suppression in 30 days, that's not realistic. That's not how that works. And I mean, that's not how science and medical data show that that's not going to happen in 30 days. And so, but maybe you can show that we're able to link people to care in 30 days. We're going to have, I mean, we made it a point to be able to, upon new diagnosis of HIV in Indianapolis, that we were going to have a linkage specialist have face-to-face contact with someone within 24 hours. That was our goal. And by and large, we were able to achieve that. And that's something that's tangible, and that's something that we can show worked and helped clients to enter into care more successfully and quicker.
But as far as truly keeping someone engaged in helping them reach viral suppression, though, that was where the real work began.
Right.
That was where the challenge.
So we've got several more questions, and I don't know if we'll get through all of them. Thank you, everyone, for submitting. Before I go to the next question, I just want to let all the participants know that if you're new to the His Health webinar training series, we always follow up with the PowerPoint presentation about a day after. That'll be Monday, as well as a survey. So we will definitely send you the slide deck, and then the webinar recordings with the video that you're watching here live and the PowerPoint presentation will be available on hishealth.org, so stay tuned. All right, next question from Esther Rose. Have you experienced any challenges applying this intervention to individuals who may have cognitive or limited learning functions, and how did you deal with that?
Yes, I would say yes, absolutely. I would say that has been challenge, because I can think right offhand, probably about 5 clients that I personally worked with that had some cognitive disabilities or some cognitive delays. So I would say in those instances, if you have family members, allies, or supporters who can help you, then that's where you have to work with those individuals and extend into the client's personal networks, because a lot of times if folks have cognitive disabilities, you may not be able to reach them in the same way. And what's helped us is having the support of a mom, of a best friend, who may be able to help us relay that information in a different type of way.
And I think also making sure that those goals for people with, you know, cognitive disabilities, that maybe those goals have to be a lot smaller and a lot more to make sure that they're attainable. So really looking at, okay, what can we achieve together, and what's realistic for maybe just today. And depends on somebody's ability, and sometimes and it doesn't necessarily have to be someone with a cognitive disability. Maybe they can't attain something if it feels too far-reaching. And so really making sure that your intervention for someone is unique and specific to their needs, and something that they're able to achieve.
Awesome. 3 more questions. Ira, and I hope I don't mispronounce your first name, Ira Manzano, asks, what would you suggest doing if a client sort of falls into the same pattern or sort of commits to the same actions time after time and they kind of can't get through a roadblock to continue in care? What are your strategies?
Well, sounds realistic.
Sounds realistic. And that was actually the reason why I chose Daniel as opposed to, I could have chosen several success stories where it was very linear and it was very just, 30, 60, 90. But for him, it's a realistic story because it happens. That's why I said it's important to train the staff on understanding the stages of change and understanding that it's a natural part of the process and that it will happen and that you will have several clients who do fall into the same patterns, that do fall into the same habits. But I'm a firm believer, though, that motivational interviewing is crucial because even when they fall into those same patterns, that's why it's important to have those goals written down so that you can reinforce why we're revisiting this conversation, why we are talking about this, why we're trying to move forward. And also, I'm trying to think of the right way to phrase this, but it's also okay to understand when you've reached your limit and sometimes when you need to maybe step back because you never want to overwork, you never want to do more work than the client in a lot of ways. Sometimes you have to. I'm not going to say never do that because, social work theory says don't work harder than the client. I say sometimes you have to, but not all the time.
In the beginning.
But when you are starting to realize, okay, the client's making no progress and I'm becoming more of a crutch, or I'm enabling the person to have this behavior because they know that they can rely on me or they know that they'll fall back on me, then I say that's when you need to take a step back. And once again, hold the client accountable, remind them of that plan, but take a step back. And sometimes it does take that for a client to realize, okay, I need to do more. And I've seen that happen on several occasions, especially when you're dealing with, for me, people who are substance users. Those are some of the most difficult people to engage in motivational interviewing. So specifically with that population, even people with mental health disabilities, disorders, is also important to sometimes step back.
I think the other piece of that that's really important is supervision. I think that can be overstated because when you're seeing that the client is kind of going through those same cycles and you're finding as a provider that you aren't reaching them and you see that this is happening, is reaching out to your networks, be that your supervisor or the peer professionals that you work with. We made sure that we had weekly staff meetings where we talked about those challenges, and I encouraged the staff to bring those challenges to the table and for us to talk about that. What's working for you, and what might how should I deal with this, and making sure that you're creating space as supervisors to talk through these challenges, because maybe if you're coming up against these roadblocks with your clients, someone else might have a suggestion that might work for you, and that you should keep trying different things, and that eventually you're not going to be in that pattern forever. You will break through with that client, and it's a matter of figuring that out, what's going to work.
Awesome. 2 more questions. Esther Rose asks, have you used motivational interviewing to motivate coworkers to use MI with their clients? And if so, what were some of the challenges and successes with that?
Yeah, I think that's certainly, and I think that kind of goes back to the ensuring that there's space for supervision. Is oftentimes we do feel stuck and like we can't figure out, this client is so challenging, and this client, we're not making any progress. And so really turning that same thing back on your staff and saying, okay, what have you tried? And, and trying to identify, okay, and what are the clients saying? What are they identifying as their goals? And maybe those are, maybe you guys are coming upon a barrier because what the staff wants for that client isn't the same as what the client wants. And so really making sure that you're creating space to have those hard talks with your staff and trying to figure out how do you make the next step
And then from my perspective, Brothers United is at heart a grassroots organization. And for us, a lot of folks, when I came on board and I was talking about motivational interviewing, how do I say this without, I'm just going to not be politically correct. They said, Tyrell, that stuff works for white people, we're black over here, like, take that motivational interviewing somewhere else. Like, that does not work for our population, you know? So what I found was it was not necessarily motivational interview as a strategy, but it was more so like the language, and people felt like how we delivered it wouldn't reach to our people because that's not how black people are reached. But being able to say, okay, you may not agree with how I rephrase that question. You might want to throw in a girl or a, an expletive. Sometimes if that's how you communicate with individuals, if that's how individuals communicate, that's okay, and it's okay to communicate more so in the lingo and the vernacular that our population understands. But at the heart, these are the basic components of motivational interviewing that we have to understand that will help us move clients forward. Because if we had all the answers, then all of our clients would be in care, they would be in mental health services, and they would be virally suppressed right now. It's just that straight talk works. So it's not working, so we have to utilize something else.
Right. I know we're running out of time, but I do have one question for you that I hope a lot of our listeners and viewers sort of tap into, because a lot of people who are watching are community health workers, medical case managers, and linkage to care specialists. You all do a lot. You give a lot. You are going through every avenue, every channel to reach folks and meet them where they are, and that can be taxing and draining on you individually. I would love for each of you to talk about what you all do for self-care. How do you renew? How do you replenish so you can keep bringing your best self to this work? Abby, we'll start with you.
I think that's an individual thing. I think you really need, but from a system-wide standpoint, I think that it's important that you make time for it and that you identify that your staff needs it. And so as a supervisor, I had to make sure that, every once in a while I would take them out to lunch or breakfast or something like that, or at least just affirm how hard this work is and acknowledge it, because we don't always get that from our supervisors, is that they don't necessarily acknowledge just how hard this work is and how draining it is, and and making sure that that you acknowledge that, and when people that your staff is successful, or when they're not, also is to be there for them when it's hard, and when our clients are, relapsing again and again, to acknowledge just how hard that is, and to acknowledge that, that Tyrell worked so hard with that client, and yet it was that same, and we went back again to, to treatment, or that they missed appointments again, and just being real about that. It's really important as a supervisor. What I do for my own self-care is that I play roller derby, and it turns out that a lot of social workers play roller derby.
Isn't that interesting?
And so finding, and I didn't always have that, and I didn't always make time for that. And so really acknowledging that it's so important that I do have self-care, and that I make time for that is super important, and it helps to get people, I guess, as it turns out on the roller derby track.
Only in roller derby.
Yeah, only in roller derby.
For me, it's about understanding what gives you peace of mind. For me, it's all about peace of mind, because the job can be very emotionally draining, just taking on others' challenges and obstacles, and then it can also be very physically draining, because in one day, your day may literally be spent from going from appointment to appointment, client to client. Like, literally, there are days when you don't eat lunch. There are days when you come in at 6 a.m. and don't stop working until 10 p.m. because of prime emergencies. So it's important to practice self-care. So for me, it was, one, understanding that it's okay for me to turn off. Like last night when a client texted me at 12:30 a.m., it was okay for me to not text that client back. You know, so it's okay for me to turn off and for me to be present in the moment, whatever that moment is. If it's the moment when I'm with my friends, if it's a moment where I'm out to the movies, if it's a moment where I'm just out having a drink, you know, being in that moment is so important. And then healthy ways to de-stress, so getting a massage, getting a pedicure, doing a yoga class, just anything that, for me, provides me with peace, tranquility, peace of mind.
And I think also something that Tyrell kind of spoke to is creating boundaries with clients.
Yeah.
And that is super important because I know in the beginning of this program, I did not do a good job of setting that up for my staff. That was something that, you know, I said, all right, we're going to be here 24 hours a day, and that's how we're going to really reach people, is that we're always going to be available. That's not reasonable.
No.
That's not okay for me to expect that from my staff. That wasn't okay for me to expect that from myself. And so making sure that we want to be available for our clients, you know, outside of regular business hours. We want to be there for them in emergencies, but we also need to help them to understand what emergencies are. And it's not that we're not going to always be there, and we're not going to always be available.
I think it's a really helpful point, sort of drawing soft lines in the sand. It's good for everyone involved. Abby, Tyrell, thank you so much. We always love having you on the webinar series. And we want to thank everyone for joining us as well. We had tons of people on this training. Again, we'll send out the deck to everyone, and the recording will be available next month when we go live in late August 2016. Exciting, hands up. I have put up Abby and Tyrell's contact information, so I've also collected your additional questions, but they are super accessible. If you email them at midnight, they may not respond until tomorrow, but you understand why now. Feel free to reach out to them with additional questions. They are wonderful, super fabulous. Thank you all again for joining, and have a great weekend, everyone.